Good evening. Today, me, the ultrasound tech student, the medical assistant, and the LMRT student, we did a simulation and we had a patient, and she was Serena Williams, and she came in due to having trouble swallowing, and she thinks it's a chicken bone. So patient history, the vitals were taken, and the vitals were pretty normal, except for respirations, they were elevated. And also the labs, there was low TSH, which in my mind, I would already be thinking thyroid issues, overactive thyroid issues, most likely. Okay. X-ray, so there was a cervical spine x-ray done, and what was found was a large density, they called it soft tissue density, in the anterior neck, consistent with an enlarged thyroid. So then an ultrasound of the thyroid was recommended. So an ultrasound, there was a right-sided heterogeneous nodule that was pretty evident, and it was fairly large. 6 centimeters was what the right lobe was measuring, and a little over 3 centimeters for the nodule. The treatment plan is a possible FNA to rule out malignancy, and there wasn't anything on here about how to make the patient comfortable with the nodule or the goiter. So I'm not sure about that. And the last part, interprofessional experience. So this simulation, I really like it. I think it's great, but I think it's really more beneficial for the medical assistants and LMRT because they haven't been to externship yet. Those of us that have, we've been doing it for a little less than a year. So patient care is something that we're kind of used to by now, and they aren't really. So I would think if a patient care standpoint is what we're trying to get done with this experience, that it should happen for ultrasound tech students earlier in the program, maybe the beginning of their first clinical rotation, or even before their first one. Maybe even just a mini simulation with just our instructors, and I don't know, but I think it is more beneficial for them than it is us. And if you want it to be beneficial for us, it would be better off being done a little bit earlier. Okay, thank you.